Okay, we're going to talk about seizures and seizure disorders today. Okay, scar tissue is frequently found in the area of the brain from where the seizure activity arises. That's called gliosis. This may interfere with the normal chemical and structural environment of the neurons. So this makes them even more likely to fire abnormally again. Changes in the function of astrocytes may play several key roles in the recurrence of seizures. Astrocytes release glutamate, and that triggers the synchronous firing of neurons. So the drug therapy is going to be focused on suppressing the astrocyte signaling or decreasing glutamate release. That may be a way of achieving seizure control. The genetic abnormalities may be the most important thing. Like we mentioned earlier, there may be a genetic link with some types of epilepsies, and other types are related to abnormalities in specific genes. Many of the genetic mutations that are associated with epilepsy appear to be acquired, though, which means they're occurring after birth, rather than being inherited mutations. So seizures, there's two major causes or classes, generalized and focal. The generalized seizure have bilateral synchronous epileptic discharges. That means both sides of the brain at the same time are affected. So it affects the whole brain right as the seizure starts, and the patient loses consciousness. With the focal seizure, it begins in one side of the brain, however, it spreads to both sides. Patient may lose consciousness in focal seizures, so it's important to know the difference here between generalized and focal. Again, generalized is bilateral epileptic discharges. It affects the whole brain right at the start, whereas focal starts in one side and then spreads. Generalized seizures involve both sides of the brain. Again, bilateral epileptic discharges in the brain. In most cases, the patient will lose consciousness. Here's an algorithm as to how to classify the seizures. We have our generalized and our focal here. Don't feel like you have to memorize this. So some of the manifestations of seizures, they may go through several different phases. There's the prodromal, the oral, the ictal, and the post-ictal. The prodromal phase, there may be sensations or behavior changes that precede a seizure. And the oral phase may have a sensory warning that is kind of the same every time, just before a seizure occurs. The ictal phase is considered the phase from the first symptoms to the end of the seizure activity. So that's during the seizure. And then the post-ictal is considered the recovery time. That's the period immediately after the seizure. Tonic-clonic seizures. This is the most common generalized seizure. So this goes in the generalized category. It used to be called a grand mal seizure. The tonic phase lasts for about 10 to 20 seconds, and that's where the body stiffens, or it's tonic. And then it has subsequent jerking of extremities, and that's the clonic phase. So we have the stiffening in the tonic, and then the jerking is the clonic. So tonic, clonic. The patient may be cyanotic. They may have excessive salivation. They may bite the tongue or the cheek, but we never want to stick anything in their mouth to try to prevent that. That may make it worse. The Post-ictal phase for tonic-clonic is characterized by muscle soreness and extreme fatigue. These patients are going to be really tired after a tonic-clonic seizure. They may sleep for hours, and they may not feel back to normal for several days. Interestingly enough, they have no memory of what happened. So, nursing considerations for a seizure. It's important to, first of all, we want to make sure the patient is not injured. So we're going to rule out any injuries immediately. But when you see a seizure start, note the time. How long did the seizure last? So it started at 8:05, it ended at 8:06 or whatever. Make sure you record the start and stop time, any details that occurred during the seizure, and then the details of the post-ictal state. And remember, that's after the seizure. What did you observe and what was the patient experiencing immediately after the seizure? But remember, your priority assessment would be injuries, but it's very important also to have a record of how long these seizures last. Absent seizure used to be called a Petit-Mal seizure. They usually occur in children, rarely beyond the teenage years. So they typically stop as a child matures, or it may develop into another type of seizure. They can be caused by flashing lights and hyperventilation. So this absent seizure, there's a video that I put up about absent seizures, the little clip on the doctor's video where they showed the little boy that would look like he was just daydreaming, and it typically only lasts for a few seconds, so it may not even be noticed. If it is a complex type of absent seizure, there may be some kind of a movement like blinking, chewing, hand gestures, and that might last 20 seconds. And if these go untreated, they could occur up to 100 times a day. So if you want to consider the child sitting in a classroom where he is having these absent seizures repeatedly, he may be missing a lot of content in the classroom. The atypical absent seizure is characterized by staring spells with other manifestations, the blinking, jerking, and so forth. Generalized seizures are further broken down into myoclonic, atonic, tonic, and clonic. So remember, again, we have the focal, we have the generalized. There's a table in your textbook that lists them all specifically for you in each category. So I'd encourage you to look at that table and make note of those different types. The myoclonic, characterized by sudden, excessive jerk or a twitch of body and extremities, and it can be forceful enough to cause a fall. It is brief, but they may occur in clusters. The atonic seizure involves tonic episodes or loss of muscle tone. It begins suddenly, the person falls, typically lasts less than 15 seconds, and the person usually remains conscious during this. And they can resume normal activity immediately after, provided there is no injury. They're going to be at risk, of injury here, possibly falling, hitting their head. The tonic type of seizure involves sudden onset of maintained increased tone in the muscles. Often occurs during sleep. It affects both sides of the body, usually less than 20 seconds, and they usually stay conscious. In the clonic seizures, this begins with the loss of consciousness and sudden loss of muscle tone. And then we see the rhythmic limb jerking that may or may not be symmetric or on both sides of the body. And these are relatively rare. Focal seizures, also called partial or partial focal seizures. Again, it begins in a specific region of the brain, or one side of the brain, and spreads from there. These may be preceded by numbness and tingling before the seizure begins.